Well, welcome back. Being pregnant amid a global outbreak of a virus with no known treatment or vaccine is not exactly comforting. The outbreak of coronavirus, or COVID-19 as it's officially known, has led pregnant women to question everything from whether they should travel, whether they should work from home, self-quarantine, or are they fine to continue their lives as normal? Okay, here to help try to answer some of those questions, OB-GYN Dr. Shavonda Shiro from Innovative Women's Health Specialist. Thank you so much, Dr. Shiro, for being here.
Thank you for having me.
Okay, so let's start by talking about this first thing. Are pregnant women more at risk?
The normal changes that happens in pregnancy can make women more susceptible to viruses like the flu virus. So they need to take extra precaution because they could. We don't know much about the coronavirus yet. But looking at old viruses, the flu, SARS virus, they could be a little bit more at risk.
Okay, and picking two things out of what you just said. First of all, there's still so many questions that a lot of doctors have. Like your patients have all these questions, but you can't answer it because experts say we don't have the answer yet about the coronavirus.
The coronavirus, SARS was a coronavirus, but this is a different strain of coronavirus. So there's different subtypes of viruses, different categories, just like they're all different cats and dogs. They're still cats and dogs, but there's all different ones. This one can act a little bit differently. So since we don't have any scientific studies and it's so brand new, we can't pinpoint what this COVID-19 is going to do.
And you said also talking about they're more susceptible anytime during pregnancy, and that's because the immune system changes during pregnancy.
The immune system changes to protect the fetus from the mom's immune system. So these changes, it's not that they're immunocompromised, but it changes to help protect the pregnancy, does make women more susceptible to viruses, the common cold, the flu. So we encourage all pregnant women to take preventative methods to stay away from people who could be sick, to use good hand washing hygiene, and to make sure that they follow the directions of their physician.
And when we talk about that and, taking steps to prevent, are we talking about, so you're not saying go as far as like self-quarantine, like some pregnant women are asking, do I need to do that?
I don't think that at this point, and this is new, and the WHO just called it a pandemic today.
Right.
But at this point, people just need to be aware of their environment. So, if they don't have to go to a church function that night where they know people are sick, they shouldn't go. But should they go to their doctor's appointments? Yes. Should they hand sanitize when they get to the doctor's office? Yes. Should they avoid touching their face and mouth? They should. And they should wash their hands, and really for a good 20 seconds, not just the soap, and then rinse the soap off underneath the sink. Really scrub between your fingers, your nails, especially women with nails, underneath their nails. And they should do that on a regular basis every time they get an opportunity, especially before they eat.
Okay, and what the last one's wrapping up here, travel. We kind of talked about, you said they shouldn't self-quarantine, but travel. Are they still good to travel?
Right now, they shouldn't do any unnecessary travel.
Okay.
Yes, because everything is new. With the airline industry trying to sanitize, we know that the air is recirculated. We know that it's carried by respiratory droplets. If you don't need to travel, if you don't need to go to a particular function, it's better to stay away and just be careful. And if someone is sick or you do have a fever, then you let your healthcare provider know and call them on the phone, because there are good protocols that we're trying to do to direct people to the right area so that we're not exposing other people to someone that could potentially be infected.
And I know you just said, as we wrap up, in your office too, you're telling people not to bring unnecessary people. Your staff's taking extra precautions in your office.
We have a hand sanitizing station that we're asking all patients to hand sanitize upon entry. We're wiping down the door handles. We are also asking patients, if you don't need to bring multiple family members to the office or your kids, don't, because it just exposes them to other potential people, and it also exposes to a possibly more vulnerable population like our pregnant patients.
All right. Dr. Shiro, thank you so much for kind of breaking this down. Lots of people still have so many questions and concerns about this, and especially you can imagine any expectant mom how they're feeling now. So again, thank you for being here with us today and sharing that information.